Hey guys, it has been a really long time since I did a vlog, and that's because I had my baby, if that wasn't obvious already. But I thought I would give an update as to how labor, delivery, and the first few months have been. So I was actually already on my last day of work before maternity leave. And so I had a massage scheduled for around noon because I wanted to try to induce labor naturally, as I had an induction scheduled a few days after Tobin's expected delivery date. So I wanted to beat that. And I told the massage therapist to try to press on certain pressure points that would, perhaps make me go into labor. And she did just that. It was a good massage. There was, some tender spots, which I think also helps, move things along when you're getting some of that deep tissue massage therapy, which is probably why they don't want you getting massages during your pregnancy. So that's something you have to be careful of as well if you're trying to get pregnant and are pregnant, especially within the first trimester. So I took a nap later that afternoon, and around 6 p.m. I felt a pop and some discharge, which was a pinky red and could have been the mucus plug. And then I guess that was like also my water breaking. So I wasn't exactly sure what was occurring, but contractions were happening every about 5 to 6 minutes. We called the OB-GYN office and they told me to go to the hospital. When I got to the hospital, they checked me out and I was already 5 centimeters dilated. So therefore I was able to get my epidural, which I highly recommend, by the way. I think that, during my 20s when I was really young, I thought that I would be able to go through, delivery without any, medications to help with pain. But the contractions become so, intense that you want to try to lessen that as much as possible. So I was able to get an epidural, and thank goodness, because the contractions were, getting very painful. I was able to manage them, but with these contractions, you want to push when you're not supposed to be pushing just yet. Therefore, I think that the epidural helps you just kind of, sort of relax for a little bit. And I was actually able to take a nap for a couple of hours before we began pushing and going through delivery. So just before midnight, we started the pushing process. So I was in labor for about 5 hours, and delivery took 4 hours, and I was quite ill, actually. So with each contraction, I would try to push, and then I would like barf. This occurred like probably 8 or 10 times. It was so taxing on my body. I was completely exhausted. So between contractions, which for me were a little erratic, even though they did give me some Pitocin to try to, have more regular contractions every, like, I don't know, I guess 3 or 4 minutes, or, less than 5 minutes for sure. But for some reason, my contractions became, the time interval between contractions became longer. For some reason, they were like 8 to 10 minutes apart. And so I would like have a contraction, push, throw up, and then get knocked out and like take like a little mini nap. And so this happened for like a span of 4 hours, which was kind of crazy, but obviously worth it. So, when you're pushing and bearing down, the doctor's like, push like you're trying to like poop. And that's kind of difficult too, because you can't feel anything from the waist down. And, Micah and the nurse were there to coach me and help me and, hold my legs. And, they're really supportive, which is, what you need. You need people coaching you and telling you you're doing a good job, because it's tough. But the delivery room was actually really serene for the most part, and it was mostly us and the nurse, and then the doctor would come in to check how we were doing, and then for the last couple hours the nurse was actually there really trying to coach me along and trying to tell me to not just push down but kind of push like you're swooping up, which is like it's kind of hard to describe, but you're not just pushing down, but you're trying to push down and then up. I don't know. Anyways, I guess that's the way the birthing canal is. You know, that's the way the path is, through the birthing canal. But yeah, so baby Tobin was born and he was healthy. He was 7 pounds and almost 6 ounces. And he came out of the birthing canal and his eyes were wide open, and I think the reaction I remember him having was like, where am I? What am I doing here? So it was really cute. But he's such a little sweetheart. And so we were actually moved to the recovery room probably a few hours after delivery, and the recovery room isn't as nice as the birthing rooms. And so we were staying in the recovery room for sure one evening, and the nurses would come and check on you every few hours, and you would have to try to produce your colostrum, and that's difficult when you've never done that before, but they try to consult you, and a lactation consultant actually did come in to speak with me and show me some tips and techniques, but I do advise that you see the lactation consultant a week or so after birth, just so that they can see how you're doing with the baby, because I feel that breastfeeding was so challenging for this first month after birth. And it's because the baby has to actually learn how to latch on properly, and the baby's so small and their mouth is small, so they can actually really ruin your nipple, by the way. And that actually happened to me the first 24 hours when I was trying to first breastfeed with Tobin. It's just they don't know how to breastfeed properly, so they're just clamping on your nipple, and I had some nipple injuries, so I had to use a breast shield while trying to breastfeed. I also had to use these gel nipple pads to try to heal my nipple, and they gave me some lanolin, and I'm using nipple butter. So it's a lot of work trying to protect, the feeding tools for your baby. But it does get easier after a while. So the first month was really hard. You're pumping after every feeding so that you're stimulating all of that milk production. And I produce some milk, but it's not enough. So I actually had to supplement with formula. And that saying, breast is best, I think that's the worst saying for mothers and puts a lot of pressure on moms. Therefore, I think that fed is best is what people should be telling moms. Because, all that matters is that your baby is fed, and that's what you want. You want your baby to grow properly and not be stressed out. And if you're not breastfeeding, properly or in the best way you can, that's okay. Just as long as the baby is fed something, and so speaking about formulas, that's a whole other world. And, at first we were just, feeding him the regular American brand formulas, which apparently have unwanted ingredients like sugars. And so we did some research, and actually my girlfriend told me about Bobby, which is a European style formula, but that's made in the USA. So we tried that, and that was fine. But then my husband, who is a bit of a nutrition snob, was wondering about the milk being used in these formulas, and whether the cows were pastured out, and, best friends with each other and frolicked freely, and grazed appropriately with pristine green grass. And actually, we did find a formula that did that. That formula is Kendamil, and it's a UK brand, and it seems to be one of the highest quality formulas out there because they not just have happy cows, but they also use whole milk. So if you notice in the ingredients, the milk is, I think, like a skim milk or non-fat milk for like all of the formulas, which boggles my mind. I don't know why they're not using whole milk, because I would think that the baby needs, that fat. So Kendamil has that, and it's organic and it seems super legit. So that's what we've been feeding him. But there's also Hip and Holly, which are your European brands as well, and he seemed to like that. He's not a picky eater, thank goodness. So that is something to also think about if you have to supplement with formula, which is totally okay, by the way. Also, there's no way I could produce enough breast milk for Tobin. He is voracious. He eats so much. Yeah, so actually going back to, recovery after delivery, recovery for like your pelvic area and your body in general takes like at least, almost 2 months. And that's why they, create a 6-week appointment with your OB-GYN so far out, because it takes that long to recover. The first 2 weeks were really rough. It felt like my pelvic floor was going to fall out of my body. It was hard for me to walk properly, so they gave me this Velcro belly band, like an elastic belly band, that would help me feel supported when I would walk around and try to get up. And I didn't use a donut to sit on, although I did use some pillows, which does help. But the first 2 weeks were super rough, so just be gentle on yourself. And I did start getting massages, a few weeks after delivery, just to help my body recover, which really, assists with some of that pain and soreness. I've had soreness in the backs of my hips, and and obviously you're trying to be as ergonomic as possible, but feeding the baby and holding the baby is a lot on your body. So self-care is really important, and you really need to try to take care of yourself in order to be able to be 100% for your baby. And it also helps to have a really supportive partner, or just supportive people around you who can help you even just feed yourself. You're just so focused on feeding the baby and making sure the baby is gaining weight properly and sleeping when it can, that Friends that provide food trains is so helpful. And hopefully you're lucky enough to have that when you need it, because yeah, the first few weeks are really tough. But these last 2.5 months have gone by so quickly. But it's really fun to watch baby Tobin grow. He's the sweetest thing. His coos are just like angelic. It's kind of ridiculous. But I've been taking a lot of photos and videos, so be sure to record when you can, because you'll want those memories. Because yeah, time goes by so quickly. But yeah, it's been hard, but we're getting through it, and I think that there's definitely joy that comes along with being a mommy, so we're super grateful to have him in our lives. So I hope I covered everything that I wanted to in terms of the labor, delivery, and recovery. But if you have any questions, feel free to, contact me. But yeah, thanks for watching and listening, guys.